Hello and welcome to B'nai Abraham Chabad for the Bright Side program. As we begin with our prayer, we'll start today with Psalm 122. I'll say it in Hebrew and English. Shir Hamalais LeDavid, Samachti ba'omrim li beis Adonai Nelech, Oimdois hayu ragleinu b'sharayich Yerushalayim. Yerushalayim habenuya ki'ir shachubra lo yachtav, Shasham alu shvatim shifteya edus lo Yisrael lahoides l'shem Adonai, Ki shama yashvu chisayis l'mishpat chisayis l'beis David, Shalu shalom Yerushalayim yishloyu ayavayich, Yishalom b'chelech shalva b'amar naitzayich, L'man achai v'reyo adaber na shalom bach, L'man beis Adonai lahinu abach shatev lach. The psalm sings the praises of Jerusalem and talks about the miracles that happened there. A song of ascents by David. I rejoiced when they said to me, let us go to the house of the Lord. Our feet were standing within your gates, O Jerusalem, Jerusalem that is built like a city in which all Israel is united together. For there the tribes went up, the tribes of God, as enjoined upon Israel, to offer praise to the name of the Lord. For there stood the seats of the justice, the thrones of the house of David. Pray for the peace of Jerusalem. May those who love you have peace. May there be peace within your walls, serenity within your mansions. For the sake of my brethren and friends, I ask that there be peace within you. For the sake of the house of the Lord our God, I seek your well-being. If you have some tzedakah nearby, please join me in this mitzvah of tzedakah. Okay. We're talking about positivity bias. It's based on this book that I'm reading, which shares wisdom, insights, and stories of the Rebbe and how he viewed others with love, with a positive eye. And many times he would quote the Mishnah in Pirkei Avot, in Ethics of the Fathers, which says, "V'havedan es kol ha'adam lekaf zchus," that when you view someone, you should always judge them to the side of merit. Find the good, find the merit in others, and what we see in others, what we look for in others, not only impacts ourselves, but also impacts the way they see themselves. Sometimes there's an individual whose positive strengths are hidden. They remain in potential, and they need somebody else to actualize them, to bring them to the forefront, to enable somebody else to see for themselves their positive character traits, to be able to overcome the weaknesses that they have. Sometimes it requires another person to help highlight that and bring it out. If you change the way you look at people, the people you look at change. And here's a beautiful story to illustrate this point. I saw this on a video clip. It was a Jew by the name of Shelley Berger, who tells the story of his childhood. He grew up in Brooklyn. He went to a yeshiva, and he tells the story that it was shortly before his 10th birthday that his sister and their mother went to 770 to visit the Lubavitcher Rebbe. And he says, my mother started crying to the Rebbe. My son is being thrown out of school. The rabbis are complaining about him. He's not listening. He's not doing his homework. He's not behaving in class. He's doing all the wrong things. And he says, my mother was crying, searching for answers, coming for guidance, coming for advice to this great spiritual leader, to the Rebbe. And so the Rebbe turns to me, a young child of 10 years old, and says, come here. And he says, I was used to the scene with many other rabbis and principals, and I provocatively started the conversation. And I said with chutzpah to the Rebbe, you're the Rebbe? The Rebbe smiled and asked me 3 questions. First, are you a good boy? I said, no. Do you like school? No. Do you listen to your mother? No. And with a big smile, the Rebbe turns to my mother and says, emes, truth. He's telling the truth, and that's good. And as Shelley tells the story, he says, wow, that was the turning point. I jumped right back into the scene. He says, with that moment, that was the moment that pulled me back into Yiddishkeit, pulled me back into the place that I was supposed to be, but for some reason, I didn't feel comfortable in. So here is a rebellious child looking for a good fight. He comes with a confrontation, with a provocation, and all of a sudden, the resistance melts away the moment somebody looks at him with a good eye. And the Rebbe saw in him a childlike innocence. The Rebbe defined him by his divine soul rather than by his defiant spirit. So when we lovingly look at others with goodness, with positivity, we help to bring that spirit out in that person. Sometimes in relationships, whether it's a family member, whether it's a friend, a colleague, or whether somebody in the community, relationships are complicated, and we sometimes find resistance. We sometimes find that people are giving us a hard time. We don't agree with the way they view life. And sometimes we hit against a wall. But perhaps if we look a little bit deeper, beyond the self-absorption, beyond what we perceive as arrogance, and we look at a soul that is in need of nurturing, we look at a soul that is in need of tender, loving care, then perhaps we can be that person to help shine the light, to help bring the person's positive character traits to the surface where they themselves can see who they really are on the inside. So if you change the way you look at the people you look at change. Our guest today is Dr. Eric Berger, the founder of Center City Pediatrics. And I can say that I'm very familiar with Dr. Berger's work firsthand, as he happens to be our family's pediatrician. So we're honored to have Dr. Berger join us for today's program.
Great.
Hi, Dr. Berger, how are you?
I'm sorry.
Try the earphones?
I can hear you now, yeah.
Okay, great.
I have a full house, with everyone working on different floors, so it's best if I keep it muted.
I can relate. Except that we have more than one person on each floor.
How are you guys feeling?
Thank God, we're doing well.
I think that's important when we talked about, what do you think about during this whole sort of pandemic? I think there's a lot. It's hard to say when you see 33 million people have lost their jobs and you see the very grim, sad death toll, but there's a lot to remind us what we should be grateful for.
Well, that's you've hit the nail on the head. That's exactly what we want to talk about. What to be grateful for and how to see the bright side in all of this. Um, we are going through tremendous challenge right now, not just in Philadelphia, but around the world. It's a global health crisis. And we're witnessing remarkable things that if you step out, you zoom out a little bit of the zoom, and you're able to see some incredible things. So I want to start by thanking you for being one of our healthcare heroes. Being a doctor is always a difficult job, but being a doctor these days is critical, and we all appreciate the hard work that you're doing, bringing healing to the world.
Well, we really appreciate your appreciation. Uh, it's hard to sort of see myself as a hero because I sort of think of the people that are really in the ICUs on the front line, but I'm much more involved in currently in a lot of preventive care, which I think is very important as well. And you can speak to that. And I
Yeah.
think we're giving people a lot of comfort too, knowing that we're there to answer their questions.
Well, preventive care is also something that people are realizing just how important it is, certainly with vaccines um, and the lack of them.
I actually think that that is one, one thing that's positive that we will remember from this pandemic is what it's like to not have a vaccine.
Right, right. Things that we take for granted.
Yeah, things that we take for granted. I think that we're actually sort of gearing up already for for the fall when we're going to be giving flu shots, as we know that we're going to have more demand than ever.
Sure.
I think people see the importance of it, and also, there's a fear about what can happen if flu coincides with COVID.
Tell us a little bit about, obviously, you are a community doctor, a pediatrician at Center City Pediatrics. Um, and tell us a little bit about how your practice has been impacted by this pandemic.
Yes, I am a community doctor in pediatrics. And just quickly, I'll say, because I think it sort of ties in what I've learned later on, which I can speak to. But people ask me, how much time do I spend clinically? What percentage of time do I spend clinically, and what percentage of time do I spend administratively? Because I started Center City Pediatrics, and I still have a large administrative role, even though I do have an administration staff. So I usually say that I'm 100% clinical, and I'm 100% administrative. And that creates a problem because sometimes it forces me to physically work too much and to have my brain working too much.
Right.
Like so many primary care offices out there, ironically, we've seen a huge slowdown in our visit volume. And that's for a few reasons. Um, we want to make sure that our office remains a place that people feel safe to come to when they need to come to it. So we actually were working at least a month before the pandemic hit the United States to prepare for this. Fortunately, one of my colleagues is a former infectious disease doctor at CHOP, and she sort of led our charge with purchasing PPE. And we were having multiple meetings thinking about how we were going to set up our office rather, so that we could care for the kids that were, as they say, PUIs, people under investigation, or even could be having mild symptoms, and be able to sort of separate them from young kids, because we knew that our mission would be more towards making sure that we don't trade one pandemic for another. In other words, making sure that we are vaccinating and doing developmental monitoring on all the kids that are particularly ages 2 and under, because that's when the majority of vaccines are done. And sort of as an aside, one of the things that's in the news, at least the news that we read as pediatricians, is that there's been a tremendous decrease in the number of kids that have been vaccinated. In fact, today I just saw one report where I think it's the like Vaccine for Children's, which is 250,000 less doses of measles being ordered, of the measles vaccine being ordered than was prior to the pandemic. And that's quite scary when we think about, could this COVID pandemic lead to a measles pandemic? So
Is that simply because, is that because patients are just not coming in to doctor's visits?
that maybe not so much in, yes, that's the answer. That is the answer because people are afraid to come to the doctor. And we've sent out many, many newsletters trying to emphasize the importance of coming in for these visits. And we want to make sure, and that was the work that we did before, set up our office so that they feel comfortable when they come in. So, like I said, ironically, so we were very busy prior to the intensity of this current pandemic. And at the beginning of it, when we were setting things up for our office to make sure that we take care of the kids less than 2 and give them their preventive care, and also setting up for telemedicine so we can keep as many sick patients out of the office as possible. We're doing a lot of telemedicine. But now, ironically, we're not as busy because we are keeping so many kids out of the office. All the kids over 2, and I'd say by far and away, the majority of typical sick visits, coughs, colds, small little things that we usually will see in the office, we're trying to do via telehealth. We are going to start staging in older kids. So that's the irony, is that we're actually less busy, which leads to an important lesson that I've learned. But
Are you able to see children um, for routine visits via telemedicine, or is that only for sick patients?
it's a complicated question. We are not doing telewells, as they call them, even though there has been a push through the American Academy of Pediatrics to get those paid for. We haven't felt like we should do that yet. We still think that there's a big value in making sure that you are with the child, even the older kids, for the well visits. Some practitioners that are doing a lot of the screening and a lot of the history via telemedicine, and then bringing the kids in for what they call a close the gap visit. And certain insurance companies have agreed to start paying for those. Um, we have not gotten there yet in
Okay.
what we need. And a lot of, honestly, a lot of what's driving that is, there was an article in the New York Times about how 50% of independent primary care offices may close due to this because
Really?
financially they can't handle, the decreased volume. And so a lot of practices are desperate just to get patients in. One thing unique about our practice is that we have so many kids less than 4 years of age, given our demographic. And also we've been so nimble in setting up telemedicine and making sure we're getting all those kids less than 2 into our office.
So let's talk about the bright side.
Yeah, the bright side.
What have you learned from this experience? Perhaps a silver lining that you've taken out of this whole health crisis on the positive side?
It's funny, I saw you had sort of given me some points to think about, and I spoke at dinner last night with my kids about what the bright side of this was. And they said a lot of things that you sort of typically hear, which is more family time. Melissa said, who's my wife, said, as you know, said, well, it's forced us to slow down a little bit. Um, I think a very important bright side of this in a pediatric office is there's a saying in running a pediatric office, which, you know, even though that is our mission to take care of kids, uh, there's a saying that is no margin, no mission. For better or for worse, it's just the reality. We have to make sure that we are seeing kids and getting the requisite number in. Otherwise, we can't keep the lights on. And to do that, often there's a lot of pressure to see lots and lots of kids. There's demands to do more and more in less and less time. And even though I think in our office we try very hard to keep it very personalized, you still feel those pressures. And you hear a lot about physician burnout. And I think one of the real bright sides is, office is this sort of time to reconnect with what drew us to medicine in the first place. Spending time with more families, more patients, spending more time with the families and patients, and connecting on a nice interpersonal way where you don't feel as rushed. And that's just the irony too, that social distancing has brought us together.
Wow, wow, that's a beautiful way of putting it.
And I think that's really nice. And I think that helps our stress level. And in some ways, it's even spiritual. I studied Musar at one point, and I think that I think an important way to important approach to the spirit is through the interpersonal, possibly to see God through the other. And I think that having this time has helped and is even rejuvenating in many ways. And there's all sorts of psychology and physiology having to do with stress hormones and learning how to quiet those that sort of gives evidence for the impact that has on physical health.
Sure, sure. When I guess when the doctor is less stressed and less pressured, then it impacts the patient's anxiety level. And if the patient is able to be relaxed and in a good frame of mind with an optimistic, positive attitude, that in turn can impact their physical healing.
No question. I feel like some of the best doctoring moments I have are not with the prescription pad, but with the connection with the person. And you can just tell that was a good healing moment. And again, the physiology supports it. We have a wonderful stress response in our brains and our bodies, the amygdala and the sympathetic nervous system. But when we are chronically sort of engaging that, I think at some point we get harm. It affects us, it affects our blood pressure, it affects our weight, it affects our immune system, it affects our ability to sort of attend to things. And if we learn to quiet that, we heal and we feel better and our bodies are healthier. And so the irony of this sort of COVID pandemic has been forcing us to slow down perhaps at home as well as at work, and maybe sort of get back in touch with this, which is maybe, a physiologic, psychological sort of justification for the Sabbath.
It forces us once a week to slow down.
If you can do that once a week, then maybe, you're going to sort of somehow sort of protect yourself from the effects of, chronic stress.
Right. It forces us to put the brakes on life for one day a week, to change our normal routine and think about what's important in the here and now. And
So perhaps this sort of COVID crisis has sort of touched that a little bit. If and I'm always hesitant in sort of speaking too positively, because I'm ever mindful of the fact that so many people have lost their jobs, and sadly so many people have lost their lives, and there is loneliness, and there is sort of a surge in mental health issues, and a surge in some of the ugly underbelly of society. But if you're fortunate enough to sort of get beyond that, there is a lot of bright side.
And that's our challenge. Our challenge is to focus on the bright side and focus on the positives, the things that we do have control over. There's a lot that we don't have control over, but certainly our attitudes and our approach can be shaped by our choices. And God has given us the free will to be able to think positively. And that's our challenge right now.
And I would say, as a doctor, it's good medicine.
Good medicine. Good for the body. It's good for the soul.
That's right.
All right. That's a great message. That's a great message. And something that we need to all internalize.
It's always a challenge. But I think it's very important.
Thank you for challenging us.
Thank you for having me. It's an honor.
All right. All the best, Eric. Take care. Thank you for joining us. And I'd like to take a moment to thank our sponsors. Thank you to Diane Tucker for dedicating this series to the memory of Dick Tucker. If you enjoy this program, please consider even a small contribution to B'nai Abraham Chabad. You can donate online at phillyshul.com. Help us keep our virtual doors open. And we'll see you next week.